Extraction in Orthodontics, a lecture given by Dr.Nadia, a lecturer and a specialist orthodontist at Arafidain University College, given for the 5th grade dental students. The main objective of this lecture is to know the indications of extraction and the guidelines of extraction in orthodontics, and to have an idea about the different extraction procedures and how we can correctly choose the tooth to be extracted. The term extraction simply means the painless removal of the teeth from their socket. In orthodontics, it represents as one of the most common and effective methods of gaining space in the arch and to establish the normal functional occlusion, especially when the jaws are too large to accommodate all the teeth. However, we should keep in mind that the decision of extraction should always be based on sound judgment, taking in our consideration the patient's age and his development and the amount of space needed for teeth alignment in our consideration. So the decision for extraction should only be taken after careful clinical evaluation or examination, cephalometric and model analysis, which has been discussed in the previous lecture, so as we can be able to assess the actual need and the outcome for such extraction. As unwise extraction may have serious consequences, like the arch collapse, like the deep overbite, spacing, and others like tissue damage. Now, what are the general indications for extraction? The first indication will be for relieving of the crowding and the alignment of the remaining teeth. In those cases, when we have an arch length tooth material discrepancy, normally there should be a harmony between the size of the dentition and the size of the dental arch. The size of the dentition and the size of the basal part of the arch is genetically determined, but in some cases, the dentition size is too large. In other words, the dentition is too large to fit within the dental arch without irregularity. So in those cases, it will be necessary to reduce the dentition size by extracting certain teeth so as we can align the other teeth. But as we said before, such a decision should be only taken after the model analysis as we have taken in the last few lectures, including the caries analysis and the arch perimeter analysis, to assess the exact amount of space needed for the proper alignment and for selection of the teeth to be extracted. Like if the space deficiency was less than 4 mm, the extraction is rarely advisable in those cases. But if we have a discrepancy of 5 to 9 mm, these cases are called borderline cases. In other words, the decision of the extraction will depend upon other factors. Factors just like the patient age, the development of the patient, the general health, the dental health of the patient, the inter-arch relationship, the patient profile. All those factors should be studied well before taking such an important decision. But if the space analysis, after analyzing the space, and we have a discrepancy or a deficiency of a space of 10 mm or more, in those cases the extraction is almost always indicated. The second indication of extraction is to correct the sagittal inter-arch relationship. When we have a malocclusion cases such as a class 2 or a class 3, it will be necessary to extract to correct or to achieve a normal inter-arch relationship, because the extraction will not only improve the sagittal relationship by aligning the teeth and moving the teeth, but also by the prevention of the forward development of the alveolar process. In cases when we have a class 1 malocclusion, a crowding class 1 malocclusion, and we need to extract from the upper arch, we have to bear in mind that in those cases the extraction should be done in the upper and the lower arch, mainly to preserve the inter-arch relationship and to prevent the development of only one arch more than the other. The situation will be different if the patient has a class 2 malocclusion. And in those cases, the decision to extraction and the decision to correctly choose the tooth to be extracted will depend on the amount of space required in the lower arch. Let us consider the first situation. This patient, just as we can see in this picture, has a well-aligned lower arch but a proclination of the upper incisors. In those cases, When we don't have to align the lower arch, it is preferable to extract only in the upper arch. And the case will be finished by having a class 1 incisor relationship but a class 2 molar relationship. On other cases, when there is a crowding in the lower arch and we need to align them, we will have to extract in the lower arch. But the decision of extraction will also depend on the amount of space that is required. If we need a great amount of space, we have to extract the lower 4. But if the space that is required is less than severe, like moderate, the extraction procedure will go as follows. We are going to extract the upper 4 to get benefit from the extraction space as much as we can to retrocline the upper anteriors. But in the lower arch, we are going to need the posterior teeth to move more than the anterior to correct the sagittal inter-arch relationship. So the case will be finished by having a class 1 incisor relationship and a class 1 molar relationship. For the class 3, the situation is different. In most cases, we don't prefer to extract in the upper arch. We prefer to extract only in the lower arch. But if we do need to extract, also the situation will be just like the opposite of a class 2. That we are going to extract the lower 4 to get benefit from the space, because when the space is close to the extraction site, when the extraction site is close to the crowding site, we are going to get maximum benefit of this space. But as we get more posteriorly, we are going to lose part of the space. So in those situations, we are going to extract the lower 4, the lower first permanent premolar, and the upper 5, so that we will have more movement of the upper posterior teeth, and the case will be ended by having a class 1 incisor relationship and a class 1 molar relationship. Now for the factors that have to be considered in the selection of teeth for extraction, whether those teeth are extracted for the relief of crowding or for correction of inter-arch relationship, we have several factors that we have to consider before deciding which teeth to be extracted, to be removed. The first factor is the condition of the teeth. The condition of the teeth have to be taken into our account when planning extraction. What do we mean by that? A fractured tooth, a hypoplastic teeth, a grossly carious teeth, or teeth with large restoration usually are more favorable for extraction than sound healthy teeth, because the long-term prognosis of the teeth are usually more important to us than the appearance of the tooth while assessing the condition. Also, it is important to consider the amount of the alveolar bone support of the teeth as well by having a radiographical examination before deciding which tooth to be removed. The second factor is the position of the crowding. Well, the crowding will be much more easily corrected if the extraction is performed in that part of the arch rather than doing the extraction in some remote, in some away part of the uncrowded part of the arch. However, the crowding of the incisor is usually corrected and relieved by the extraction of the premolars, as it gives us in the majority of the cases a more aesthetic appearance and more occlusal balance than removal of the incisors. Usually we prefer to extract the first premolars for the relief of the crowding, as they are positioned in the center of each quadrant. So the extraction space can be used for the relief of the crowding in both the anterior and the posterior segments. The third factor is the position of the teeth. The teeth that are grossly malpositioned or transpositioned and would be very difficult to align are usually it will be more preferable to be extracted. And we have to bear in mind sometimes that the position of the apex of those teeth will be very difficult to be aligned than moving the crown. So all these considerations have to be think about when decide which tooth is going to be extracted. Of course, there are other factors like the patient profile, like the age of the patient, like the dental development of the patient, the presence of the other teeth. All these factors together will play a very important role in deciding which teeth we are going to extract. Now let us consider the extraction procedures. The common extraction procedures we are performed in The first extraction procedure is named a balancing extraction. From its name, it's mainly used to keep the balance of the arch. So it is defined as a method of extraction where removal of another tooth on the opposite side of the same arch is done. Usually after extraction, the teeth that are distal to the extraction space will move into that space, while the teeth medial to the extraction space can move distally into that space. So the midline of the arch may shift to the side where we have done the extraction procedure, creating asymmetry within the arch. To avoid those unaesthetic side effects of extraction, unaesthetic shifts of the dental arch, single side extraction is usually avoided, and it should be balanced by extraction of the another tooth on the opposite side of the same dental arch, just like we are seeing in this picture. This patient has a severe crowding, but it's localized to the lower right segment of the arch. So in this case, it is indicated to extract the lower C. But if we do extraction on only the right side, we will get a shifting of the teeth to the right side. So to prevent this shifting, as we said before, we have to extract the other side or the left side. The second extraction procedure is the compensating extraction, which simply means we have to remove the equivalent tooth in the opposite arch to maintain the buccal occlusion. Especially in cases when we have a class 1 crowding cases, it will be mandatory to extract in both arches to maintain the lateral symmetry. So the main aim of the compensating extraction is to preserve the inter-arch relationship by allowing the posterior teeth to drift forward together. The third one is the enforced extraction. Those extractions are usually carried out because they are necessary, as in the cases of grossly decayed teeth or periodontal, very bad periodontal status of the teeth, or if we have a fractured tooth, if we have an impacted tooth that is very difficult to be aligned, just like we can see from those pictures. The fourth extraction procedure is the Wilkinson's extraction. Wilkinson prefer extraction to do extraction for all the four first permanent molar between the age of 8.5 and 10 or 9 years old. The base for doing an extraction for the sixes at an early age to allow the impaction of the third molar, and also because those teeth are usually erupt early in life, and so they are more susceptible to caries, so they do prefer to extract them. But we have to keep in mind this is an older procedure and it is not usually done nowadays because it has many drawbacks that are going to be discussed later in this lecture. The last extraction procedure is the therapeutic extraction. Those extractions are usually done for the purpose of orthodontic treatment. In those cases, we have certain sound, healthy teeth that have to be sacrificed to facilitate the proper alignment of the other teeth, especially in those cases of severe arch length tooth material discrepancies. Now the other subject is the choice of teeth for extraction. Now let us start with the maxillary incisors. Usually they are rarely indicated for extraction in orthodontics because they are aesthetically very important, as they are the most prominent teeth in the dental arch. But there are certain indications, such as we can see here from those pictures, if the tooth is very badly carious that are difficult to be restored, or if we have a fractured upper central, or if we have a resorption of the roots of the lateral or the central due to an impacted upper canine, or sometimes if we have a palatally situated upper lateral and the general arch is well aligned, or we have a favorable contact between a central and the canine. And there are certain cases when we have a congenital missing of the lateral in one side, but we have the other side lateral. In those cases, we prefer to do extraction to keep the symmetry of the arch. So we are going to extract the other side lateral and we do a prosthetic treatment or whatever to keep the symmetry of the arch. The lower incisors. As a general rule, we have to avoid the extraction of lower incisor because we have several drawbacks. The first one, it will be difficult to align the lower 3 incisors with the upper 4 anteriors, and we will lose the midline. Furthermore, we will have a lingual inclination of the lower anterior and deepening of the bite and narrowing of the intercanine of the lower intercanine width, and this will also affect the upper intercanine width and may lead to the reappearance of the crowding. But we do have several indications. For instance, just like we can see from this picture, if the lower arch is well aligned and the lower incisor is completely excluded from the arch, we have to extract it. The second circumstance is if it has a bad periodontal status with a gum recession and bone loss, just like we can see here. Or if the patient has a mild class 3 malocclusion with the lower incisor crowding, the central incisor can be removed to obtain a normal overjet, normal overbite, and relief of the crowding. So we will have a class 1 incisor relationship, but the molar relationship will be class 3. Let's consider the canines. Usually they are not routinely extracted during the orthodontic treatment. As they are one of the most important teeth in the mouth, they play a very important role in the guidance of occlusion, as we have explained previously, by guiding the maxillary and the mandibular canines into their final intercuspal relationship. Besides, they are of high aesthetic value. They provide very good support to the face, and by extracting them, we may encounter flattening of the face and we may lose the balance of the face. The facial expression will be changed. So all of these should be considered. Furthermore, they are one of the longest and strongest teeth in the mouth, and they provide excellent anchorage in the alveolar bone. And sometimes, in certain cases, in which we have crowding in the lower arch and the canine sometimes will be difficult to be aligned, we may consider extracting them. But in the majority of the cases, we should avoid extracting them because the contact between the lateral incisors and the canine are rarely satisfactory. However, there are indications, like if they are very badly carious, as we may see from this picture, that are difficult to be restored, or they are completely excluded from the arch and we have a well-aligned dental arch with a good contact between the premolar and the lateral, we may consider extracting it, or it is severely impacted or grossly displaced from their eruptive pathway. You know that the canine have a very long path of eruption and they can be deflected from their normal eruptive pathway. So in these cases, when it is very difficult to be aligned, and we have to keep in mind that aligning the canine is not only aligning the crown of the canine, we have to consider also how we are going to align the apex of the canine, which is in most of the cases is difficult. So this impaction, if it was associated with the resorption, it will be definitely indicated for extracting. Premolars are our favorable teeth for extraction, and they are routinely extracted as part of orthodontic treatment for many reasons. For instance, they are located at the center of each quadrant of the dental arch, so the space that is gained by their extraction can be used to relieve the crowding of the anterior or the posterior segment of the arch. Secondly, they can be replaced by the second premolar, which nearly has the same shape and make a similar contact with the canines. And mesiodistally, they are slightly larger than the second premolar, so they can give us more space. So their main indication for extraction would be those cases when we have a moderate to severe amount of crowding. In another word, we have more than 5 millimeter of space discrepancy or space deficiency. Also, they are extracted routinely as part of the serial extraction, and also they are used to correct the moderate to severe anterior proclination, like in cases of class 2 division 1 or class 1 bimaxillary protrusion. We are going to extract both the upper and the lower first premolars, and we are so to lessen also the time of the treatment plan. Also, when we have cases of high anchorage demand, we prefer to extract the first premolar over that of the second premolars, because the molars, along with the second premolars, will provide us more and sufficient anchorage in such cases. So for all these reasons, we prefer to extract the first premolars over other teeth. For the second premolars, also they are routinely and commonly extracted during orthodontic treatment, but they are next to the first premolars. Their main indications for extraction are usually when we have a mild space discrepancy, when the space required for the correction of malocclusion is minimum, as in cases of mild anterior crowding or mild anterior proclination. So by extracting the second premolar, we have to keep in mind that the soft tissue profile and the facial aesthetic can be maintained. So this is, as we said in the beginning of the lecture, it is one of the things that we have to consider when deciding which teeth to extract. Like if the patient have a favorable and a nice looking facial profile, we want to keep it, and the facial profile is straight or slightly convex, and we don't want to increase the convexity of the patient profile, or in other words, we want to maintain the facial profile and the appearance of the patient. We have to consider extracting the second premolars. So the second indication for their extraction when they are completely excluded from the dental arch. As you know, they are erupted behind the first premolar and the first molar. So sometimes when we have a space deficiency, they are going to be excluded from the arch. In those cases, it will be more easier to extract those transpositioned or excluded teeth. Thirdly, when we have a premature loss of deciduous second molar, that may cause medial migration of the first permanent molar, leaving inadequate space for the second premolar to erupt, just like in this picture. So in such cases, the second premolar may erupt completely out of the dental arch and will be indicated for extraction. Also, when the anchorage requirement is minimum, in those cases, when the anchorage loss is actually desirable, so the extraction space is going to be closed by the retraction of the anteriors as well as mesial movement of the molars. In other words, we don't want this space of premolar extraction, let us say it's about 7 to 8 millimeter, is completely closed by the posterior movement of the anterior teeth. We want part of this space to go for the posterior teeth also. As we said before, if we would like to maintain the facial profile of the patient, and we don't want to make an overcorrection or over-retraction of the anteriors, we will prefer to extract the second premolars. Other indications, that, like if they are grossly carious or periodontally compromised, or in cases when we have an open bite, as they are located posteriorly, their extraction will help us to deepening of the bite, will encourage the deepening of the bite. The first permanent molars are considered as the cornerstone of the dental arch, and they play a key role in the establishment of occlusion, so they are usually not extracted during the orthodontic treatment for many reasons. Like extraction of the first molars usually doesn't provide us adequate space for the relieving of the anterior crowding, as they are located away from there is a long span between the position of the first permanent molar and the anterior teeth. This long span means that we are going to lose a lot of space during the retraction of the anterior. We are going to have a loss of anchorage, in other words. Besides, extracting the first premolars usually cause deepening of the bite that is not always favorable or desirable. Also, by extraction of the first molars, the second premolars, as we can see here from this picture, and also the 7 may tip towards the extraction space. And they are also important for mastication, so the mastication is also going to be affected. So almost always we don't extract the first permanent molars unless they are severely or grossly decayed, or they are periodontally compromised that with poor prognosis that are difficult to be treated. In those cases, we are going to be obligated to extract them. We have certain guidelines for the molar extraction that we have to follow. Like when the crowding is absent or confined to the premolar, or means it's limited to the premolar area, region, segments, and no space will be needed for the anterior alignment, it will be more preferable to extract the first molar before the second molar will erupt, so that to allow the second molar to be drifted and move forward during the eruption and take up the place of the first permanent molar position. So the optimal time or the best time for doing this when the bifurcation area of the root is reached during the development of the 7, which is about between the age of 8.5 to 10 years old. But when the space for the molar extraction is needed for the alignment of the anterior teeth, it will be more preferable to wait for the second molar to be erupted, so that the space will not be taken by the forward movement of the second molar. The second permanent molars are located at the end of the dental arch and therefore they are away from the site of crowding. Their extraction doesn't help us in relieving of the crowding, but they have certain indications. But we have to make sure that the third molars are in favorable angulation, position, and size, shape for their eruption before extracting the 7s. The first indication will be the facilitation of the distalization of the upper buccal segments. In cases of class 2 malocclusion, when we want to correct the sagittal inter-arch relationship by distalization of the maxillary teeth, of the maxillary buccal segment teeth, we need to extract the second permanent molar if we want to gain more space. And also, if we have a mesial drift of the upper first permanent molar, like in cases of early extraction of the second primary molar, so we want to make distalization of the 6s, we need to extract sometimes the 7s. Also, if we have a mild lower premolar crowding, and finally, if they were badly curved. Molars are usually not extracted for orthodontic treatment, but they are one of the commonly extracted teeth, but for other reasons, like for impaction, like for pericoronitis. In the past, the early extraction of these teeth has been advised to prevent the lower labial segments. However, it is much more likely that the late lower incisor crowding is caused by other factors, like the late growth, the soft tissue changes that continue to occur throughout the life. So nowadays, it is not acceptable anymore to extract the third molars purely on the grounds of preventing the crowding of the lower labial segments, because upon studies, they have found that people who have extracted the third molar, when we compare them to the people who didn't do the extraction, both of them all develop the late lower incisor crowding. So, as a conclusion, we don't recommend extracting the third molars for orthodontic treatment, but it is commonly extracted for reasons other than orthodontic treatment. This is the end of the lecture. Hope you enjoyed it. Thank you for your nice listening. Please, if you have any question, do not hesitate to contact me at the electronic site of the college.